for joining us to help choose home when care is needed. A podcast all about the benefits and value of receiving care in the place that you likely feel most comfortable, wherever you call home. I'm your host, Merrily Orsini, and I've been involved in healthcare at home since 1981. Each episode, I'll be talking with a guest who will help us in our quest to educate about healthcare at home. So let's get started. Today's episode is number 6, and today's guest is David Totaro, Chief Government Affairs Officer at BAYADA Home Health Care. David is also chair of the Medicaid Partnership for Home Care and very active on a state, regional, and national level in healthcare at home. David, thank you so much for joining us today. The whole purpose of this conversation is to really try to educate consumers or referral sources about helping choose home when a care need arises. And you've been so active in government affairs for BAYADA. Is there any kind of legislation or some things happening now that as a consumer that someone might want to know about?
You know, there has been a great shift over the last several years towards managed care, so that states are giving away their responsibility to manage the treatment of patients post-acute from the state to a group of insurance companies. And we have been advocating a lot recently to make sure that the managed care companies are following the rules and regulations that the states so rigorously created for the home care industry in the past decade. In New Jersey, for example, we have just been successful in getting legislation approved that would mandate that any payer of Medicaid, including managed Medicaid services, must pay at a rate that is equal to or greater than the rate paid by the state. We're also advocating in several of our states for increased reimbursement for both home health aides and for nurses. The biggest issue I think that faces home care today is the supply versus demand issue. While we do believe that there is a caretaker shortage, we do also know that with increased wages for both our home health aides and our nurses, we have seen as much as 50% of the supply issue corrected just through increased reimbursement.
Now that's interesting. That just for our consumer audience, because most people think about when the government pays for something that you don't have to think about that. But in this cost-cutting environment we're in right now, home health and home care seems to be taking an inordinate share of the burden in cuts. Would you agree to that?
Yes, I would, and it is concerning. It is probably, in my opinion, because we have not raised our voice as loud as the footprint that we have would mandate. The ones who are getting the attention and are getting the reimbursement, a greater portion of the reimbursement, have been those who have much better and bigger abilities to fund the re-election campaigns of the legislators who make these decisions. However, we probably, as an industry, home care probably has among the largest footprint that's available, but we haven't been able to develop it into a movement that's become effective.
When we're talking about healthcare at home, we're talking about a workforce that goes out into private homes. So they are distributed. They are not aggregated in one place, whereas in a brick and mortar structure, a hospital or a nursing home, you actually see the building and you have people that work together that whole day long in one place.
Well, that's correct. You know, I've often noted that as you drive through your community, whether it's New York City or a rural community in Kentucky, and you pass a hospital, you see a big, broad structure, you immediately know that there are probably well-known figures within that community who are on their board of directors. And so the understanding of the power that a hospital system may yield in your community is evident. However, as you drive down the neighborhood streets, you're not aware of what's going on inside those doors. And in all probability, as often or even greater amount of time, folks are being cared for at home, where they get better quality care, where the care is more efficient or less expensive, and most importantly, they're being cared for where they want to be. However, that is in many instances unknown to the community at large.
Right, which is really the main reason that we are educating about helping choose home, because we do see in certain areas of the country there is not as much usage of the home care services and the home care benefit as in others, and it does seem to come directly from being discharged from a hospital or from a facility, that people should be choosing home at that point.
Probably the biggest referral source is from the hospital, and the education starts there. They have traditionally chosen more expensive settings. It's the easier setting for them to make a referral to. However, I think we can all see that there has been significant growth over the last, say, 3 to 5 years. My own company will move into any location, any state where we can get someone who wants to work or create an office in that state, because we do believe that home care is something that is universal, and that people, there's a significantly large percentage of the U.S. population who wants to be cared for at home.
One of the things that I've noticed, and I'm just asking, I guess, for some type of reassurance on my thought on this, most people don't seem to think about care until that care need arises. And at that point, they are faced with a decision. And one of the things I'm hoping will happen, and I know you certainly are doing this with your advocacy legislatively, one of the things I'm hoping will happen is that people will start thinking about choosing home earlier, or start exploring some of the options about staying at home versus moving elsewhere, and understand that the consumer does have a voice. The consumer does, don't they, have a voice in where they are being placed after they leave the hospital?
Yes, more so today than before, because consumers are becoming much more aware of their ability to make that choice and the various choices that they do have. I do believe, though, that as home care becomes more prevalent, and I've seen, and I think you can agree, Merrily, that over the last, even the last decade, the increase in the number of folks who are choosing home care has dramatically increased. That as this continues to occur, our state legislators, who are getting older and who also either are looking for care for themselves or for their elderly parents, are beginning to choose home care. And they make the decisions about where the reimbursement dollar goes, and how it impacts the various post-acute settings. And as this occurs, I believe that awareness levels among the total fuller population will increase as well.
I'm going to switch gears just a little bit here, because Bayada's done some innovative things with the workforce, and as you call our supply, our supply of people to provide these home care services. What are some of those innovative things? I know one of them was a transportation program. Are you all finding that some of those additional support services to try to get the caregivers to work and support them, are those being helpful in your markets where you're trying that?
We have tried a number of innovative ways, including the transportation program that you referred to. We also just recently went to Puerto Rico to recruit nurses for our offices in Minnesota on a short-term 18-month basis, recognizing that many nurses in Puerto Rico were not able to work because of the hospitals being shut down. So we're looking at a variety of different ways to increase the workforce. However, we do recognize that there just aren't enough caregivers today to handle the population in the future. And so we are looking at, as well as working with nursing schools directly, creating mentorship programs, trying to develop programs where we can work with the nurse while she's still in school and circumvent the one-year residency requirement of home care. And all of them have had a small marginal effect, but positive.
Let's go back to your original comment about the work that you're doing in terms of state by state and trying to get managed care to increase wages for home care. If a consumer has a choice of, and it's a legitimate choice of being able to come home with care or to go to a skilled nursing facility, then is the pay the thing that really is stopping that supply, and you're finding that managed care, if they increase that pay, did I hear you say that, actually does make a difference in the workforce?
It does. In Pennsylvania last year, we were able to get our nurses increase for the first time since in about 8 years. And that increase, which was about a $3.50 per hour increase, actually reduced the number of open shifts. Open shifts are the shifts that are authorized but not filled. We were able to reduce those open shifts by more than 50% in just 6 months. So it does have an impact. And the reason it has an impact is that it enables us now to compete for nurses who are already working in higher paid settings such as nursing homes or in the hospitals.
Well, let me ask you this. To the government or the managed care organization that is reimbursing for this care, is it still not a lower cost alternative, even with increased pay, to choose home care?
Absolutely, and it makes us all wonder why they continue to choose a more expensive setting.
Particularly one where people probably don't want to be. I mean, have you ever met anyone that wants to go to a hospital or to a nursing home?
I don't think anybody ever wakes up in the morning and says, gee, this would be the time I want to go into a nursing home.
I think that's probably true.
Now, we do recognize, Merrily, and I think you have said this many times yourself, is that not everyone can be treated for at home.
Right.
It's a very high percentage, over 90% that can, but there are some folks who just don't have live in an environment or maybe have a family network that can be able to support someone living at home full time.
Right, but one of the things that a lot of people don't know is that you can get home care even if you have moved your place of residence. So if you move to an assisted living facility or to probably not a nursing home, but you definitely can get home care in congregate housing.
That's true.
Yeah, you all service wherever someone calls home, correct?
Exactly, yeah, assisted living facilities everywhere. The other thing that occurs in many states, and we're working right now in Pennsylvania to correct this, is what's called presumptive eligibility or deemed eligibility. Mm-hmm. One of the challenges many folks have is that they're not deemed eligible for Medicaid home care when they leave the hospital immediately, as they are deemed eligible for nursing home care. Mm-hmm. In many cases, it takes up to anywhere from 3 to 6 months to go through the process of getting approved. And during that time, you're either at home without care, which means you end up possibly or probably back in a hospital setting, or you'll go directly into a nursing home. And then when that happens, many folks just never do leave the nursing home.
I was totally unaware of deemed eligibility. Is that a Pennsylvania-specific criteria?
No, in fact, it's in many states. We're only aware of 6 states that immediately deem you eligible for home care as you are deemed eligible for nursing home care.
Well, that sounds like another project for you to work on legislatively around the country.
We do. We actually are working on it in every state that BAYADA has operations in. We're at the closest of getting it changed in Pennsylvania. It just passed the House by a unanimous vote, 191 to nothing,
Goodness.
which is really amazing. And now it's in the Senate and going through the relevant health committees.
And this deemed eligibility, is this a hangover from some other era when home care was not considered as widely helpful and low cost and high value as it is today?
It is. It's a holdover from about 25 to 30 years ago.
Goodness. Well, as our population ages, we're all going to probably at some point in time, hopefully later, need some type of assistance. And I know I certainly want it to be at home if possible, and I'm assuming you do too.
Well, I'm hoping that I'll never need either. But I did personally experience home care myself just a couple of years ago for a 4 to 6 week period, I guess.
Really? Tell me about that.
Well, I had a hip replacement and was able to, unfortunately, recuperate in an area that my own company does not service, but did experience the work of another home care company. And I do believe that because of that, I was able to get back to work much quicker. My wife was able to continue to work during the day when I was needing care, and it made her more comfortable that I was being well taken care of. So there are so many benefits, not only to the patient, but to the whole family with home care.
Let me go back to that. If you could remember that, when you had the operation, were you involved in the discharge planning from the hospital and insisting on home, or was that something that they were comfortable with without your prodding them?
No, they gave the hospital where I had the surgery gave me a list of 3 or 4 recommended home care agencies. None of which, to be honest with you, even though I've been in the industry for a long time, none of which I was familiar with. And so we had to do research and call around and get references on each. Even the referral manager in the hospital was hesitant about making a specific recommendation. Although I have noticed in my own career, though, that many hospital referral individuals do make recommendations. Particularly, they'll give you the top 2 or 3.
Well, good. Well, I'm glad that you had that experience and that it was a positive experience. And
I can also say, Merrily, that one of the areas that we get quite a few referrals from are state legislators. It's interesting that many folks who are confused about what home care is about, or whether they qualify, or who they could go to for service, will call their state legislator. And it makes sense because your state legislator is there to help solve your problems. And I can tell you, probably once a week we get a referral from a state legislator. And we probably are getting those because we're known as advocates for the home care industry.
right, well, hopefully, a few years from now, we'll all be advocates for the home care industry, and we'll work you out of a job so you don't have to to work as hard as you.
I can tell you, we certainly need to do so. We have a large enough footprint that we can be very, very powerful in moving the healthcare solution in favor of where people want to be treated and cared for.
Well, I love the idea of utilizing that large footprint for the positives for home care. And David, I want to thank you so much for your time today and for your tireless work in the industry. It really is appreciated. And those consumers who don't know how much work you're doing, you're moving the needle, and it's really, really beneficial where you're having an impact. So thank you for joining us, and thank you.
Thank you. It's always nice to talk with you, and I appreciate the honor you've given me to be able to speak today.
Thank you so much for listening today, and a special thanks to our sponsors and partners, National Association for Home Care and Hospice and corecubed. Join us to spread the word and help choose home when care is needed. You can access more helpful information on helpchoosehome.com and on social media.